If you are between 75 and 85 years old, and you wake up every morning with pain in your knees, your hips, your lower back, or your feet, reassuring, I want you to know something important. That pain is not just part of getting older, it is a signal. Your body is telling you something, and more importantly, that pain can be reduced significantly with the right morning routine, done consistently, every single day. I am Dr. Daniel Chen, and today I am going to show you exactly what to do every morning before you even leave your bedroom to walk with less pain, more stability, and more confidence than you have felt in years. Encouraging. Now, before we get into the routine itself, I need you to understand something first, because if you understand why this works, you will actually do it. And doing it consistently is everything. Here is what is happening inside your body when you sleep at night. Your joints are still for 7 or 8 hours. The synovial fluid inside your joints, that is the natural lubricating fluid. That keeps your cartilage from grinding against bone. That fluid becomes thicker during sleep, less mobile, less effective as a lubricant. This is why the first steps of the morning are always the hardest. This is why you feel stiff and sore the moment your feet hit the floor. It is not weakness, it is simply biology. Now here's the good news. Synovial fluid responds immediately to gentle movement. The moment you begin to move a joint, even very gently, the fluid warms up, it becomes thinner, more liquid, more effective, and the pain begins to reduce within minutes. There is also a second reason why mornings are so painful for adults between 75 and 85. During sleep, your muscles lose their active tension. The muscles around your knees, your hips, your ankles, and your spine. These muscles are responsible for supporting your joints, for absorbing the impact of every step you take. When those muscles are cold and inactive first thing in the morning, your joints absorb all of that impact directly, with very little protection. That is pain, that is stiffness, that is the shuffle that many older adults develop without realizing why. And there is a third factor that most people in this age group never hear about: inflammation, specifically nighttime inflammation. Research has shown that inflammatory markers in the body peak during the early morning hours, between roughly 2 and 8 in the morning. This is why conditions like arthritis and joint pain are almost always worst first thing in the morning. Your body's inflammatory response has been active all night, and the joints feel the result of that the moment you try to move. But here is what the research also shows. Gentle targeted movement in the morning activates the body's own anti-inflammatory response. It stimulates circulation to inflamed joints. It encourages the release of natural pain-reducing compounds. And it signals the nervous system to reduce its pain sensitivity, all within the first 10 to 15 minutes of waking up. That is what today's routine is designed to do. And the best part, you do not need any equipment. You do not need to go outside. You do not need to get on the floor. Every single step of this routine can be done from the edge of your bed or from a sturdy chair right there in your bedroom. So let us get into it. The first thing to do before you even stand up is ankle circles. While you are still sitting on the edge of your bed, lift one foot just slightly off the floor and slowly rotate your ankle in a full circle, 10 times in one direction, then 10 times in the other direction. Then switch to the other foot and repeat. Now this may seem too simple to matter, but I want to explain what it is actually doing. Your ankles are the foundation of every single step you take. If your ankle joints are stiff and poorly lubricated first thing in the morning, every step you take sends a poorly absorbed shock straight up through your knee, your hip, and your lower back. Ankle circles warm up the synovial fluid in the ankle joints immediately. They activate the small stabilizing muscles around the ankle, and they begin waking up the circulation in your lower legs and feet. In adults between 75 and 85, poor ankle mobility is one of the leading contributors to falls and to the shuffling gait pattern that develops when the body tries to compensate for stiff ankles. 30 seconds of ankle circles costs you nothing and begins the entire warming up process before your feet even touch the floor properly. The second thing to do is seated knee extensions. Still sitting on the edge of your bed, straighten one leg out in front of you as fully as you comfortably can. Hold it straight for just 2 seconds, then slowly lower it back down. Do this 10 times on each leg. Now, here is why this matters so much. The quadriceps muscles at the front of your thigh are the primary muscles responsible for protecting your knee joint. Every time you take a step, every time you stand up from a chair, every time you go up or down a step, your quadriceps are working to absorb impact and stabilize the knee. But in adults between 75 and 85, the quadriceps are often significantly weaker than they should be. Research published in the journal Arthritis and Rheumatism found that quadriceps weakness is one of the strongest predictors of knee pain and knee-related disability in older adults. Seated knee extensions directly activate and strengthen these muscles without putting any weight or pressure through the knee joint itself. They are gentle, they are effective, and done every single morning. They build a level of protection around the knee that reduces pain with every step you take throughout the day. The third thing to do is a seated march, still on the edge of your bed. Simply lift one knee up towards your chest as comfortably as you can, then lower it, then lift the other knee. Alternate like this for about 20 repetitions on each leg, slow and controlled, not fast. Now, the seated march does several things at once. It activates the hip flexor muscles, which are responsible for lifting the leg with each step. In many older adults between 75 and 85, the hip flexors become extremely tight and weak from long periods of sitting. When the hip flexors are weak, the lower back has to compensate, and that compensation creates the lower back pain and stiffness that so many people in this age group experience first thing in the morning. The seated march also activates the core muscles, the deep stabilizing muscles of the abdomen and spine that protect the lower back during walking, and it begins to warm up the hip joint itself, encouraging synovial fluid circulation before you put any weight through that joint. The fourth thing to do is a standing calf raise. Now, this is the first exercise where you will stand up, so please stand behind a sturdy chair and hold the back of the chair with both hands for support. Once you are standing comfortably, slowly rise up onto the balls of your feet. Hold for just 2 seconds at the top, then slowly lower yourself back down. Do this 10 times, nice and slow. The calves are the body's second heart. That is not just a saying, it is physiology. The calf muscles are responsible for pumping blood from the lower legs back up toward the heart. In older adults, poor calf muscle activation leads to blood pooling in the lower legs and feet. This pooling causes the swelling and heaviness in the legs that many adults between 75 and 85 feel when they first stand up in the morning. Calf raises immediately activate this pumping mechanism. They improve circulation throughout the entire lower body. They strengthen the muscles around the ankle, reducing fall risk, and they improve the push-off motion. That is the final push your foot makes with each step. When push-off is weak, walking becomes a shuffle. When push-off is strong, walking becomes more fluid, more natural, and far less painful. The fifth thing to do is a standing hip hinge, still holding the back of the chair for support. Stand with your feet about shoulder width apart. Now slowly push your hips backward, like you are about to sit down in slow motion. Bend slightly at the hips and knees, just a small bend, maybe 20 to 30 degrees. Hold for 2 seconds, then slowly return to standing. Do this 10 times. Now this movement activates 2 of the most important muscle groups for pain-free walking in older adults: the glutes and the hamstrings. The gluteal muscles, your buttock muscles, are the largest and most powerful muscles in the entire human body. They are responsible for extending the hip with each step, for stabilizing the pelvis as your weight shifts from one leg to the other, and for protecting the lower back from excessive strain. In adults between 75 and 85, the glutes are almost universally weaker than they should be. Research consistently shows that gluteal weakness is one of the primary drivers of hip pain, knee pain, and lower back pain in older adults. Because when the glutes are not doing their job, the lower back takes over, and the lower back is not designed to carry that load. The hip hinge activates the glutes and hamstrings in a gentle and controlled way, without placing any strain on the joints. And done every morning before your first steps of the day, it prepares your most powerful muscles to do their job properly. From your very first step, the sixth thing to do is gentle spinal rotation. Sit back down on the edge of your bed. Sit up as tall as you comfortably can. Place your hands lightly on your thighs. Now slowly rotate your upper body to the right as far as is comfortable. Hold for 2 seconds. then slowly rotate to the left. Hold for 2 seconds. Do this 5 times in each direction. The spine contains a series of small joints called facet joints. These joints also contain synovial fluid, and they also become stiff and compressed after a night of lying still when the facet joints are stiff. Every rotation and turning movement of the upper body during walking becomes limited and painful. Gentle spinal rotation warms up these joints, encourages fluid circulation, and reduces the compression that builds up in the spinal discs overnight. Research has shown that disc pressure is actually highest in the first hour after waking, because the discs reabsorb fluid during sleep and become slightly swollen. Gentle rotation helps distribute that fluid more evenly, reducing disc pressure and reducing the back pain that is so common in the first hour of the morning for adults in this age group. The 7th and final step of the morning routine is your first walk, but not just any walk. I want you to take your very first steps of the day deliberately, slowly, and with full attention before you rush to the kitchen, before you go to the bathroom, before you do anything else. Take 20 to 30 slow, deliberate steps right there in your bedroom or along the hallway. Focus on placing your heel down first, then rolling through the middle of your foot, then pushing off with your toes. Heel, middle, toe. This is called a heel-to-toe gait pattern, and it is the natural human walking pattern. But in adults between 75 and 85, pain and muscle weakness often cause this pattern to break down. The foot begins to land flat, the push-off disappears, and the shuffle begins. By practicing your heel-to-toe pattern deliberately for just the first 30 steps of each morning, you are reinforcing the correct movement pattern through your nervous system and making it more automatic throughout the rest of the day. Now, let me also talk about something that most morning routines leave out completely, but that is absolutely essential for pain-free walking in this age group, and that is what you eat and drink in the first 30 minutes of waking up. The first thing you should do, even before the exercises I described, is drink a full glass of water. During sleep, your body loses fluid through breathing and perspiration. Even mild dehydration increases the concentration of inflammatory substances in the blood and reduces the volume and effectiveness of synovial fluid in the joints. Many older adults wake up already mildly dehydrated and then take their first painful steps without realizing that part of that pain is simply from lack of fluid. A full glass of water before you do anything else begins rehydrating your joint fluid immediately. The second nutritional step is to eat something with anti-inflammatory properties. Within the first hour of waking, tart cherries or tart cherry juice are one of the most powerful anti-inflammatory foods known to research. They contain compounds called anthocyanins that directly reduce the inflammatory markers that peak in the early morning hours. A study published in the Journal of Functional Foods found that older adults who consume tart cherry juice daily experienced significant reductions in markers of inflammation and reported meaningful improvements in joint pain, particularly in the morning. Turmeric is another exceptional choice. The active compound in turmeric is called curcumin, and curcumin has been shown in multiple clinical trials to reduce joint inflammation with an effectiveness comparable to some non-prescription pain medications. Add a quarter teaspoon of turmeric to warm water or to warm milk first thing in the morning, and do this every single day. Consistency is what makes it work. Omega-3 fatty acids are also critical. For adults between 75 and 85 with joint pain, omega-3s reduce the production of inflammatory compounds in the body. At a cellular level, a small handful of walnuts with breakfast, or a tablespoon of ground flaxseed added to oatmeal or yogurt, provides a meaningful daily dose of omega-3 fatty acids without any medication and without any side effects. Now, I also want to address something very directly, because I hear this from patients all the time. Dr. Chen, I am 78 years old. Is it not too late for exercise to help me? And my answer is always the same. It is absolutely not too late. In fact, some of the most powerful research on exercise and aging has been done specifically in adults over 75. A study published in the New England Journal of Medicine followed adults between 70 and 89 years old who participated in a structured daily movement program. The results were remarkable. Major mobility disability was reduced by 18% compared to a control group. That is not a small number, that is nearly 1 in 5 people avoiding serious mobility loss simply through consistent daily movement. Your muscles respond to exercise at any age. Your joints respond to movement at any age. Your nervous system adapts and improves at any age. The biology of recovery and adaptation does not stop working at 75 or 80 or 85. It simply requires more consistency and more patience than it did when you were younger. But the results are real, and they are waiting for you. Starting tomorrow morning, let me bring everything together for you now. If you are between 75 and 85, and you wake up every morning with pain, here is your complete morning routine while still sitting on the bed. Ankle circles, 10 in each direction on each foot, seated knee extensions, 10 on each leg, seated march, 20 repetitions on each leg, then standing at a chair, calf raises, 10 repetitions, standing hip hinge, 10 repetitions, then sitting again, gentle spinal rotation 5 times each direction, then your first deliberate walk, 20 to 30 slow heel-to-toe steps, followed by a full glass of water, and within the first hour, something anti-inflammatory, tart cherry juice, turmeric in warm water, a handful of walnuts. The entire routine takes between 10 and 15 minutes. That is it, 10 to 15 minutes every morning, before your feet hit the floor with full weight, before your cold, stiff joints absorb the shock of your full body weight, before the pain sets the tone for the rest of your day. Instead, you warm up the fluid in your joints. You activate the muscles that protect those joints. You reduce the inflammatory response that peaked overnight, and you walk into your morning with stability, with confidence, and with significantly less pain. I am Dr. Daniel Chen. If this routine helps you, I genuinely want to hear about it. Leave a comment below and tell me how your mornings feel after 1 week of doing this. Your experience matters, and it may inspire someone else watching this video who needs to hear that it is possible to feel better at any age. Please share this video with someone between 75 and 85 who starts every morning in pain, and subscribe to this channel for weekly videos made specifically for older adults who want to live stronger, move better, and feel well every single day. You deserve to walk without pain, and with this routine, that is exactly what you are working toward.